Namaskar दोस्तों. Welcome to Toxicology on Board. Today we will in this video will discuss around total 6 questions which were previously asked in either DABT recertifications or it's a very well uh, frequently repetitively asked topic in case of DABT. So let's see what is the topic for today's video. Today we'll discuss about solvents, ethanol, methanol, fetal alcohol syndrome, and toxicology. Today we'll discuss about the two main important solvents which are alcohols, ethanol and methanol. Ethanol is metabolized by zero order kinetics. A fixed amount is removed per unit time. Very important when it comes to toxicology. One of the important thing is whenever you are working with any particular chemical, you need to know about its pharmacokinetics and toxicokinetics. Here, as you can see, that ethanol is undergoing zero order kinetics. Okay, that is the reason a fixed amount is removed per unit time. Okay, next important thing is alcohol dehydrogenase. This is the enzyme which is the main liver enzyme which is responsible for the metabolism. Okay, so here you see ethanol is there. It is metabolized by the enzyme alcohol dehydrogenase to acetaldehyde, right? So ethanol is oxidized to acetaldehyde CH3CHO. Acetaldehyde dehydrogenase. This acetaldehyde is further metabolized by the enzyme aldehyde dehydrogenase to acetate. Okay, so ethanol metabolism. Another solvent we are going to discuss methanol metabolism. Alcohol metabolism you need to remember. Next important point is fetal alcohol syndrome is characterized by mental deficiency and microcephaly as well as specific facial characteristics. Here you can see fetal alcohol syndrome. Small head is there, small eye opening, low nasal discharge, flat mid face, smooth pylithrum, right, and thin upper lip. Okay. Next, we'll discuss about the second alcohol. No, still, ethanol can potentiate or increase the hepatotoxicity of. So again, you have to very important these particular terms: synergistic, additive, potentiation. These are all the terms that you need to remember. So ethanol, when it is used along with chloroform or trichloroethane or trichloroethylene or dimethyl nitrosamine, okay, aflatoxins. So whenever alcohol, when it is used with all these solvents or these chemicals, there is a potentiation or increase in the liver toxicity. Okay, next, other alcohols, methanol, 2-propanol can also potentiate the effects of hepatotoxin. So you have to understand ethanol, not only ethanol, also when methanol is used with these solvents or these chemicals, 2-propanol or isopropyl alcohol, when it is used along with this, in your question, if you find these options, definitely you have to choose the option potentiation or increasing in liver toxicity, right? Next, there is a sufficient evidence for the human carcinogenicity of ethanol IARC for the oral cavity, pharynx, larynx, esophagus and liver. So important thing that we need to learn is about IARC. IARC is International Agency for Research on Cancer. Okay. So IARC, what does it do? It conducts some on certain chemicals which they identify that they are having potential for causing cancer. So they do 2-year bioassay, both mice and rat studies, and then they also based on literature also they will classify these particular chemicals as either class 1 or class 2A, like that IARC classification is there for so in another video I will definitely bring the IARC classes. Okay, today we'll stick only up to this one. Okay, so ethanol is having sufficient evidence for human carcinogenicity. Okay, so it is causing oral cancer, pharynx, larynx, esophageal as well as liver cancer. That is the reason you should not drink alcohol. So we have pharynx. Here in the diagram you can see mouth cancer, breast cancer, intestine, bowel, liver, esophagus as well as larynx. Alcohol increases risk of at least 7 types of cancer. Okay. Next, we'll discuss about the second solvent, which is nothing but methanol. Methanol mainly produces blindness via toxicity to the retina. So, ethanol is causing liver cancer, and this second alcohol, which is methanol, we have to characteristic feature it. This causes ototoxicity. Okay, in your option, if you come, which of the following causes blindness, then you have to blindly go for the option methanol. Metabolic acidosis is also produced by this methanol. The metabolism produces formic acid. Okay, here you can see that here you can see methanol. Methanol undergoes by the metabolism aldehyde dehydrogenase and forms formaldehyde. Formaldehyde is further metabolized by aldehyde dehydrogenase to formic acid. This formic acid is the one which is responsible for causing blindness. Okay, primates are good models for methanol ocular toxicity. So again you have to read about sensitivity of the species, which is the most appropriate species for conducting either pharmacology or toxicological studies. In this case of methanol, primates or monkeys are the right species to understand ocular toxicity, right model, whereas rat is not susceptible to cause ocular toxicity. Next, ethanol can be used as an antidote for methanol poisoning. So one thing again you have to remember is that whenever you are reading about any chemical and its toxicity, you have to learn about, is there any antidote available for that particular chemical. So in this case of whenever there is a methanol toxicity, you can use ethanol as a antidote. So any patient who comes to an emergency department, the physician has a choice. He can treat the patient who is overly ingested methanol, that can be treated with ethanol. Okay, so let's see what are the characteristic features of methanol toxicity. It causes headache, dizziness, altered mental status, confusion, seizures in severe cases, coma in severe cases. So in the emergency department, if you find a patient with this type of symptoms, you can assume you can predict, you can start that he might be with methanol toxicity. GI disturbances, vomiting, nausea, loss of appetite, decrease in appetite. So metabolic acidosis, as you have seen in the previous slide, chest pain misdiagnosed as acute myocardial infarction, increased respiratory rate. So if there is an increased heart rate, hyperventilation, shortness of breath, acute visual changes. As you have seen, methanol causes blindness, impaired vision, delayed treatment. Okay. So next see, let us see. So as I said in the beginning of the video only, total around 6 questions I will be you will be able to learn from this video. So let's see what is question number 1. Toxic effects of which of the following can be prevented by ethanol? Option A, methyl alcohol. Okay, I will not discuss other options because total 6 questions are there. So ethanol toxicity can be treated can prevented by ethanol. Okay, so methanol or methyl alcohol toxicity can be treated with ethanol. Okay, if in this actually isopropyl alcohol also, I assume that this is the right answer, but more appropriate is methyl alcohol. Go back and check what is the, if isopropyl alcohol, rubbing alcohol, some type of this are also there. You check what is the antidote for this type of alcohol. Next, which of the following compound is least likely to potentiate carbon tetrachloride hepatotoxicity? So we have already studied about various chemicals, around 5 chemicals we have seen. So whenever they are used along with alcohol, it causes, increases, potentiates liver toxicity. So methanol causes, ethanol causes, acetone causes, isopropanol. This is nothing but isopropyl alcohol. So benzene is the one which will, when it is it doesn't increase the toxicity, liver toxicity of carbon tetrachloride. Benzene causes cancer. Okay, remember that one. Okay, I think mostly it is leukemia, blood cancer, I guess. Blindness is a toxic effect produced by ingestion of methanol. So this is a direct question, right? Methanol causes ocular toxicity. Okay, why? What is the toxic product which is formed? Formic acid, right? And how, when ethanol is used, how can you prevent that? Means you can use ethanol. So whenever a patient is with methanol toxicity, you administer ethanol. What happens, both methanol as well as ethanol, both are metabolized by the enzyme alcohol dehydrogenase. So all the enzyme will go and metabolize ethanol, but there will be less enzyme alcohol dehydrogenase enzyme less available for metabolism of methanol. As a result, there will be no formation of formic acid, so there will be no ocular toxicity or metabolic acidosis. Next, let us see question number 4. Which of the following does not potentiate the liver toxicity of carbon tetrachloride? Same direct question, aldehyde. So remember, the best way to remember is whenever there is a ketone group, acetone, or alcohol group, ethanol, butanol, butanol, all these four will increase the toxicity of carbon tetrachloride except for aldehyde. Okay. Next, let us see question number 5. Enzymes capable of metabolizing ethanol to acetaldehyde include. This you blindly remember in your brain: alcohol dehydrogenase, catalase, and microsomal ethanol oxidizing system cytochrome P452E1. Okay, of all the three, option 1, 2, 3 are the right answer for this one. Okay. Next is this you will learn in lesson. I will, in the next slide I will give you even the page number or table where you will find across this particular enzyme CYP450 to E1. Next, let's see option number question number 6. The biotransformation of product of methanol responsible for delayed acidosis, formic acid. As you see, formic acid causes acidosis, metabolic acidosis, as well as it causes ocular toxicity, which is nothing but blindness. Let's see. So as I said, this is taken, these two pictures are taken from Clayson ninth edition, page 1125 as well as 1126. I would request you to go back and read the book. As I said, this in see, these are the possible mechanisms of ethanol causing cancer. CYP2E1 induction by ethanol increases metabolic activation of procarcinogen. That's why in our option CYP2E1 is also there. Okay. Next diagram is about the difference in the metabolism of methanol in both primates as well as rodents. Okay, rodents and not rodents. Okay, as we have seen that primates are the best model, sensitive model to understand ocular toxicity of methanol. Okay, so in primates, methanol is metabolized by the enzyme alcohol dehydrogenase, whereas in the case of rats or mice, it is metabolized by the enzyme catalase. Once methanol is, it is converted into formaldehyde. Aldehyde is formed. Alcohol is converted into aldehyde. This is again metabolized by, in the case of primates, by formaldehyde dehydrogenase. In the case of rodents, same enzyme, formaldehyde dehydrogenase. But here limited H4 folate is there, here abundant H4 folate is there. And finally the product formed is carbon dioxide. So conversion of formate to carbon dioxide is rapid in the case of rats, but relatively slow in the case of primates. Okay, so primate may toxicity is more when compared to rats because of the enzyme. So this is how you have to link everything when you're reading for your exam also. Okay, hope in this video you have learned about the two types of alcohol, their toxicity, antidote, fetal alcohol syndrome also we have learned. Okay, so thank you so much. Be curious. For any questions, please comment or write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on Board. Thank you. All the best for your exam.